My name is Elizabeth Eves and I'm from London. I studied a Master's in Global Health Policy at the London School of Hygiene and Tropical Medicine. I decided to study this particular programme because it was offered on a distance learning basis. And one of the attractions for me was the really interesting course content and the ability to learn from multidisciplinary colleagues from across the world working in different time zones and in different global health contexts. The most surprising thing for me during my degree was how much you can cram into your time if you plan it really carefully. So I worked full time whilst I completed my master's over 5 years. And an essential element to that was really meticulous time planning and being very self-disciplined. And I sometimes fascinated myself by how much I could get done if I was really disciplined. My favourite aspect of my programme was the fact that I could learn at a time that suited me and fitted it around my own personal and professional commitments, and also to learn from people all across the world. So during the pandemic, it was fascinating to really be learning in real time how people were implementing what we were learning on the programme in real life context, and evaluating that on an ongoing basis was a really fascinating way to be able to learn. There were a whole range of different academic resources available. So we had physical access to libraries and also virtual libraries, which obviously being a distance learning course was really important. But on a sort of more pastoral note, the support was absolutely incredible. As a student with sight loss and progressive sight loss that worsened during my studies, the university were incredibly supportive and made sure that I had all of the resources I needed to be able to flourish in my academic study. My plans post-graduation are still very fluid. One of the really great things about the programme was that it's given me great context of lots and lots of different global health issues and contexts, and particularly post-pandemic. I'm still really teasing out how my degree is going to best be able to make me an effective member of the global health community in a post-pandemic environment. I would wholeheartedly recommend a University of London degree for its flexibility, its support, its reputation, and its amazing course content, which is constantly updated, kept live and interesting, and just further fueled my desire to continue my academic learning. I feel immensely proud to be here today. I've completed my master's over 5 years, at which point sometimes felt very long. It's been a real labour of love, and I feel, particularly having a disability that has progressed during my study, I feel incredibly proud and thankful to the university for having given all the support they have.